In the spring of 2009, public health officials were alerted to an unusual outbreak of influenza.
Tuesday, we reported that we had confirmed 2 cases of influenza that were swine flu in children in California.
On April 23, 2009, the CDC announced that this strain of influenza had not been seen before in the U.S. or anywhere in the world. It was a new strain of flu.
Today, Mexico's Minister of Health confirmed that they have cases of swine influenza in people, and that they believe some of the people who were infected died from swine influenza.
The world was confronted with a new flu virus to which it appeared no one had immunity. The potential existed for a severe pandemic. The public health community responded.
Last night, I arrived in Washington and immediately after my swearing in met with officials from the White House to discuss the national response to the flu outbreak.
Yesterday, we announced the release of material from our strategic national stockpile.
Currently, the FDA and Centers for Disease Control and Prevention are developing virus reference strains. HHS and the Food and Drug Administration will monitor the manufacturing of a potential vaccine and conduct strict oversight to ensure that the vaccine is safe and effective for use. As the vaccine manufacturing is underway, the NIH will also conduct clinical trials to make sure that the best dosage and formulation of the vaccine is available.
Over the last week, my administration has taken several precautions to address the challenge posed by the 2009 H1N1 flu virus.
Those precautions included disseminating public health recommendations through a variety of media and developing a candidate vaccine virus in less than 3 weeks. By June, there were 18,000 cases of H1N1 flu in the U.S.
WHO has officially declared us to be in a pandemic.
In July of 2009, scientists and public health experts from across the country came together in a pan-flu summit at NIH to discuss the most effective ways to minimize the impact of the H1N1 flu.
We're aggressively planning for a vaccination program.
The National Institutes of Health directed clinical trials of the H1N1 flu vaccine beginning in August. Trials were conducted on adults, children, pregnant women, and individuals with underlying health conditions.
I believe this is something that this federal government and this administration is doing correctly. And I hope that the American people will support the government and support their fellow citizens by getting immunization to the H1N1 virus in the order that they are supposed to take it, and will follow up.
HHS announced it was making $350 million available in grants to state and local agencies for pandemic preparedness resources and activities. HHS and the public health community continued to spread the word on not spreading the flu.
As I said when we saw the first cases of this virus back in the spring, I don't want anybody to be alarmed, but I do want everybody to be prepared. We know that we usually get a second, larger wave of these flu viruses in the fall, and so response plans have been put in place across all levels of government. For all that we do in the federal government, however, every American has a role to play in responding to this virus.